Hello dear students. So we can start the psychiatry session, and the very first question goes like this. There is a patient who has presented to the psychiatry OPD, and when the psychiatrist asked him like what's your name, the patient replied the same exact words. Right? So what is this known as? Repetition of the same words is whatever is being asked, that is known as echolalia. So echolalia is repetition of exact same word. Exact same words. And then there is one more term, that is neologism. What does this word neologism means? Any idea? Neologism means, yes, very good. So patient will use some new words whose derivation cannot be understood. So the doctor is not able to understand that what is the source of these. Yes, of course, it is seen in schizophrenia. So neologism, new words. New is actually new. So echolalia. Next question. A lady complained of sudden onset of breathlessness, anxiety, palpitations, and feeling of impending doom. The moment you have this impending doom, think of panic attack. So this is a panic attack. Impending doom with anxiety, palpitation, sweating, breathlessness, everything is panic attack. Now, a patient had a very severe road traffic accident 6 weeks back, right? And now the patient is very fearful of driving, and he have flashbacks of that accident, and therefore he is avoiding going to office, and he don't want to go, don't want to drive the car through that route. So that is a very classical case of post traumatic stress disorder, right? So PTSD, yes, this PTSD, and the time period is 6 weeks. That, like anything, the event is like 1 month old, and then the patient have what is known as flashback. That is very important here. Patient has again and again he just remembers all those episodes, and he becomes very fearful. So that is post traumatic stress disorder, and it can be related to many events like some severe accident, right? Or some sexual assault cases, or some warfare, or any event. This is which brings some bad memories to the patient, is post traumatic stress disorder. Now next question, continuous rigorous hand washing, especially in females, this is obsessive compulsive disorder. Yes, this is particularly in females. So this is obsessive compulsive disorder, and actually there are two components of this psychiatric disorder. Yes, everyone is right. So one is obsession. Now what does this word obsession means? Obsession, what is the meaning of obsession? Obsession means there are repetitive thoughts. So the thoughts, they will come again and again in the mind. So those are repetitive thoughts actually. And the another component is compulsion. So it means the patient is compelled to follow those thoughts. So there is the patient is forced, or you can say compelled, to follow those. So this is OCD, that is obsessive disorder. And yes, in a case of Females, this is washer. He will wash hands again and again. And in a case of male, this is checkers. So they will keep they will keep on checking whether the door is locked or not, or whether they have locked their suitcase or not, thing like that. So that is checker. They will check the things again and again, and ladies, they will wash their hands. So this is in short about OCD. Now the next question: a 10 years old child is very restless and hyperactive, and he just keeps running in school and disturbing his classmates. So this is a very classical picture of attention deficit hyperactivity disorder, and there are again two terms. One is attention deficit, and second is of course hyperactivity. So the child won't finish one thing and will start doing another thing, and you can say there is a sort of impulsivity. So that there might be impulsiveness, and or the patient jumps from one activity to another. Hyperactivity means he will change his seats, or he will keep roaming in the class. So that is hyperactivity. This is ADHD in a patient. And as far as the treatment is concerned, what we will give? We will give stimulant medicines like, any idea what? Yes, methylphenidate. Very. We give methylphenidate in child. And what drug in adults? ADHD can be seen in adults as well. So in a case of adult, we will give tamoxifen. Clear? Very easy to identify a case of ADHD, and which is condition especially seen in children. Now next question, again one very important, childhood psychiatry. So we'll do that later. So there is a boy who failed in exam and started doubting that the school teachers have conspired against him. Right? Very good. So this is delusion of persecution. So this is delusion of persecution, and before that you should understand what is delusion as such. Now what is this delusion word? Word delusion. Anyone, what is delusion? Delusion means, yes, so this is false, unshaken belief, right? And this is unamenable to reasoning. So the patient has a fixed belief, yes. So there is a fixed belief that this is fact, and even if you say that you are wrong, he is not going to listen to you, even if you give proof to show that thoughts are wrong, but the patient is not going to deviate from those thoughts. So that is delusion, false unshaken belief. Now persecution means to harm, right? So the patient will feel as if the people in the society, they are planning to harm in some or other way. So here in this case, the child feels as if the teachers, they are planning to fail him, and they are just trying to harm him, or they are just trying to trouble him. So that is delusion of persecution. So harm in some or other way, and in case of school, that is about academics, right? So this is, yes, perfect. So this is delusion of persecution. And then we have many important delusions, like we can have the delusion of grandeur. What is delusion of grandeur? Yes, Chiki, you are right. What is delusion of grandeur? Yes, like you. Yes, yes. So in some, like, it may be a person might think that I am very rich, or I am very influential, or I am very powerful. So it can be anything. So you can write powerful, influential, anything. So patient might say that I am God. That is delusion of grandiosity or grandeur. Then we commonly see delusion of nihilism. What is delusion of nihilism? Any idea? Delusion of nihilism. Yes. So the world is about to end. Very good. World is about to end, or I am about to decompose, like that. So that is delusion of nihilism. So these are few important delusions which you should remember. Everything ended, right? Now, next question. A young patient with self-mutilating behavior and impulsivity. In biochem, we discuss self-mutilating behavior for Leschnian syndrome, but in psychiatry, it is different. Yes, it is borderline personality disorder. And what is this word impulsivity? Impulsivity, what does impulsivity mean? Impulsivity. What is the word impulsivity in psychiatry? Yes, so there is a strong urge which patient can't resist. Yeah. Is impulsivity. So urge of, yes, strong urge of doing something. Now, next question. A pregnant female was in psychiatry OPD with a bipolar disorder. Now, which drug we should not give to the patient? And I think most of you, yes, will answer it perfectly. So this is lithium, because teratogenic effect of lithium is in anomaly. Remember that. Yeah. Don't give lithium to a pregnant lady. Now, psychiatrist asked the patient that, how is your mood? The patient replied that his mood is up and down, but up and down are the part of life, and one should live life to the fullest. Now, this is what type of speech? Yes, Gulshan, you are absolutely right. This is tangential speech. This is tangential speech. And what does actually tangential speech mean? So, tangential speech really means that the person, yes, there is, the person will not reply to the question in an exact manner, and he will just, he will just move somewhere around the question, but he will not specifically answer the question asked. So, no specific answer to the question, but he will reply in relation to the words which are there in the question. So that is tangential speech. Right? So suppose if someone asks you, like, would you like to go to the movie? So rather than saying yes or no, you will reply something like, these are not good, or like that, something like that, right? So no specific answer to the question, but something related to the question here and there. So that is tangential speech. Clear? Now, next question. A young female went to the psychiatry OPD with elevated mood, hyperactivity, spending excess money, and reduced sleep. What is the most appropriate drug in such case? Yes, so I think most of you can make a clear-cut diagnosis. Now here, see, mood is elevated, right? There is hyperactivity, spending excessive money, and there is less speech. What is the diagnosis here? Diagnosis is mania. Here, yes, mania can be a part of bipolar disorder. It is followed later on by depression, right? But in this particular case is mania, because we can say elevated mood, hyperactivity, spending excess money with reduced speech, and there is easy distractibility, delusion of grandeur. So all those, the case history of mania is very specific, and for mania we need to give lithium. The answer is lithium. Not going into the details of mania, I think the case history is quite obvious and everyone can make a clear-cut diagnosis of mania. So next question. A widow female staying alone starts believing that her relatives are planning to kill her so that they can take her property, right? So this is again delusion of persecution. So again, you can just correlate here that there is some strong belief about harm, causing harm. So that is delusion of persecution. Clear? Persecutory delusion. Yes, perfect. Then next question. Occasional alcoholic has a change in his behavior. Now he is very suspicious that people are trying to conspire against him. But his father says that there is no reason to think so. And he is also having hallucinations of voices commenting on his action. This is a very, I think most of you can answer it perfectly. Yes, what is this? Puneet, Chiki, yes, you are right. Now this is schizophrenia. Now let me tell you, let me explain you in fact how you can get up to the clear diagnosis. Now here, see, number one, the person is not a regular alcoholic. He is an occasional alcoholic, and therefore, and here we don't have any, anything like alcohol withdrawal. There is no history like of that, something like that. So we don't go for delirium tremens at all. So there is no concept of delirium tremens because there is no mention of alcohol withdrawal, right? And whenever you have a case history of delirium tremens, obviously you might have some 48 hours duration of alcohol withdrawal. That duration will be specifically mentioned. And moreover, the patient is not a regular alcoholic. Clear? So these 3 points are not there, so we can exclude delirium tremens. Again, the second one can be excluded because there is no regular alcohol intake. Now, the students might confuse between C and D, that delusional disorder. Now here, you have to specifically note down one word, and that is hallucination, right? Of course, he is having delusion, but also there is mention of hallucination in this particular question. And whenever you have a question, you cannot be, very choosy in taking up the clues. You cannot just look at this delusion of persecution and then you can go for delusional disorder like that. You have to consider the word hallucination over here, right? Of course, so one component in the question is delusion of persecution. Yes, it's obviously there. Patient is feeling as if the people in his society, they're planning against him and they want to cause some sort of harm, right? So that is okay, delusion of persecution. But at the same time, in the question, it has been mentioned that he have hallucinations of voices which are commenting on his actions, commenting on his. Now, what is this word hallucination? What is the meaning of hallucination as such? What is hallucination? What do you mean by the word hallucination? Any idea? It is a disorder of hallucination. Is that, yeah, very good. So it is a disorder of perception. Now here what happens? Perception is present, but external stimulus is absent, right? So there is no stimulus, but still the patient is perceiving here. And this can be any type. It can be auditory, can be visual, right? It can be tactile, can be gustatory, can be olfactory as well. We can have any type of hallucination. And I think most of you must remember cocaine bugs. That is tactile hallucination. The patient will complain as if the bugs are creeping under my skin, right? That is tactile. Anyway, if coming back to the question, now what you are able to understand in this question is hallucination of voices. So this is what kind of hallucination we are talking about? This is auditory hallucination. Yeah. So in reality, no one is talking, but the patient will say, I can hear voices, someone is talking about me. And in terms of schizophrenia, this is known as third person hallucination. When he will hear two voices which are discussing the patient in reference, so that is known as third person hallucination. He will say that I am hearing voice, people, they are talking and they are talking about me. So that is third person hallucination, and that is very characteristic, although not diagnostic, but very characteristic for schizophrenia, right? So if you take these 2 points together, you can easily come to the diagnosis of schizophrenia. So third person hallucination, very important here, and this is actually auditory hallucination. Patient will hear, yeah. So that way you can exclude the possibility of delusional disorder. If this word hallucination shouldn't have been given, then obviously we could have considered it. So this is, yes, everyone, right. So this is a typical history, case history of schizophrenia. Yes. Going forward to the next question. A post-operative patient developed hallucinations and confusion. Now again, just to confuse you, there is occasional alcohol intake. What is the diagnosis here? Yes, everyone can answer. This is delirium. Now delirium, yes, this is organic mental disorder. Very good, Agu. Now for delirium, the usual case history will start with post-operative, because this is very commonly seen in post-operative. Number one. So the moment you get any psychiatric condition, and if it starts with the word post-operative, or if the word post-operative is included anywhere in the case history, 90.9% it is going to be delirium. Number one. Number two, confusion. That is very important. The another important word is confusion, because delirium is also known as acute confusional state. Yeah. So it itself is known as acute confusional state. And when we say that there is confusional state, it means there is clouding of consciousness. There is clouding of, yeah, and clouding of consciousness means the response or reactions to the circumstances is not sharp or accurate. So this is clouding of consciousness. And apart from that, there will be disorientation. Can be in terms of time, place, or person. So that is disorientation. This is, yes, this is an organic disorder. Very well said. It is an organic mental disorder. And whenever we use the word organic, what does this word organic actually mean? Any idea? What does this word organic actually mean? Whenever we are using the word organic, it means there is some underlying brain pathology. Clear? So there is some underlying brain pathology, and whenever you take the word organic brain disorder or organic mental disorder, you usually discuss two conditions. One is of course delirium, and second is dementia. Clear? So two conditions are in this term organic mental disorder. Anyway, I guess the word delirium is clear to all of you. The case, an ideal case history should always start with post-op word. Clear? Then there is confusional state, and this word alcohol is just to confuse you so that you can go for alcoholic hallucinosis or you can go for Wernicke-Korsakoff psychosis. Those are not the answer here. Perfect answer is delirium. Please, this is very important entity, delirium. So next question. Young male was having COVID-19. Now after 4 months, he feels that the infection is still continuing and he might die soon. And the moment he thinks so, he started having sweating, palpitations, and impending doom. Otherwise, physical examination is normal. So this is a classical case of, see, we have a very specific word here, impending doom, right? So the moment you have the word impending doom, you don't have to go here and there. Simply mark panic disorder. Yes, Gulshan, you are right to an extent, but the word impending doom has to be correlated with panic disorder. If the word panic disorder would not, if the word impending doom would not have been here, then definitely we would have considered post-traumatic stress disorder as well. But impending doom, no other answer. Clear? Gulshan, you are right to an extent. There is that thought process also, and without impending doom, we could have thought of PTSD as well. Yes, Gulshan, you are right. But I think impending doom, no other choice except panic disorder, right? So the moment, and panic disorder, you can see it is lasting only for a few minutes, and that is with impending doom, I think, yes, okay, great. Next question. A lady is having fear of taking elevator and he prefers to go by stairs till 7th floor. Now what is this? Yes, this is claustrophobia. So claustrophobia means, in claustro word is for closed spaces. Simpler terms, you can say closed spaces like lifts. Okay? So that is closed spaces. Now what is this word? Agoraphobia. What is agoraphobia? What is agoraphobia? Yes, Raghu, you're right. The agoraphobia has two definitions actually. One was old and one is the new revised. In old, we used to say fear of open places. And nowadays, what we say, fear of crowded places. Right? Crowded places like railway station, fairs, exhibitions, right? Where there is a lot of crowd and the patient will feel that going to a safe place is not possible from here. So he will avoid all those crowded places. That is agoraphobia. Yeah, bus stand, okay. Yeah. Now I think zoophobia everyone can answer is fear for animals, and social phobia, which is very common in clinical practice, even in day-to-day life, like performing or addressing from stage. Person will have a fear to go on stage and he will fear have addressing a public, some performing in front of the public. So that is in short about phobia, right? Now, next question. A female has headache for last 6 months and she have several consultations. Everything was normal, but she still insists that something is wrong and therefore he is looking to he is looking for some other consultation. So most likely diagnosis. Yes, I think it's quite easy. This is hypochondriasis. And how we define hypochondriasis? Yes, very good. So there is a very, there is a belief of very serious illness, despite all investigations normal or assurances that there is nothing like that. So that is hypochondriasis. And yes, there is the body functions are normal, but there is abnormal preoccupation. So there is abnormal preoccupation. So problem is within the thought of the patient and not in the body as such. Abnormal preoccupation of normal body functions, that there is something wrong in my body. Yeah. So this is hypochondriasis. And despite having so many consultations, everything coming normal, belief doesn't go up. Next question. A child has normal learning skills but poor mathematical skills. IQ is also normal for that particular age, and he failed in mathematics exam with poor marks. What is this? Very good. So this is specific learning disorder, and here we can see this is for mathematics. Yeah. So this is specific learning disorder, and most of the times we see that the child is very poor in maths, although he is good in other subjects or the other developmental milestones they are perfectly achieved, but still he is poor in mathematics. So that is specific learning disorder, may be related to mathematical calculations. Yeah. Next question. A lady complains of hearing voices, and which are actually comments about her looks. She feels as if the people are inserting their thoughts in her mind. Now, what is this? I think now everyone can mark it perfectly. Yes. In terms of options, what could be the answer here? Okay, we will take the words. Now here you are having two things, number one and number. We'll take the option clues here. Hearing voices about her, right? She is hearing voices about her looks. So this is what actually, this is an auditory hallucination, number one. And the second point is inserting thoughts in her mind. Now, yes, Punit said absolutely right. This is thought insertion. Here, if you add up these two, I think there is no reason to think anything except clear. There is no reason or there is no way to go beyond schizophrenia, because whenever you have this particular term, auditory hallucination, whenever you have this particular term, auditory hallucination, perfectly, particularly the third person hallucination, my dear friends, don't think anything beyond schizophrenia, right? And the moment you have this particular term, no need to go further in the question. The answer has to be schizophrenia, right? So the moment you find this third person hallucination or any voices, and even if there is no third person hallucination, even if you have this anything related to auditory hallucination, 99.9% it is going to be a case of schizophrenia, right? So no problem. See, we are here to learn the things only. So at times we might perceive the things in a wrong manner, but we should learn and we should, we should be quick learners so as to avoid the mistakes in the exam, right? So the term auditory hallucination is schizophrenia. Third person hallucination is 99.9% schizophrenia, right? And this thought insertion again is a very contributory clinical symptom of schizophrenia. And in relation to thoughts, we can have other thing as well, like thought. Okay, so in relation to, there are few terms in schizophrenia which are which starts with actually thought. So one we have already discussed, this is thought insertion, right? So patient will say that whatever I am speaking, this is not my thoughts. Somebody else is inserting the thoughts into my brain and I am just simply picking them out. So that is thought insertion. Another term is thought withdrawal. Very good. So the second term is thought withdrawal. And what is this thought withdrawal? Suppose he is talking to you, he is answering your question, and then he will stop suddenly. And when you will say, yeah, you were saying something, please continue. Now he will say that whatever I was saying, my thoughts has been taken away by someone else and I don't know what actually I was saying. I am totally, I don't remember at all what actually I was saying, because all those thoughts has been stolen by somebody else or has been taken away by someone else. So that is known as thought withdrawal. There is one more term, and that is thought diffusion or broadcasting, right? So what will happen? The patient will say that whatever others are thinking, they are actually my thoughts, which has diffused out of my body into their mind, and now they are repeating the same words. They are actually my thoughts. So that is thought diffusion or thought broadcast. So the moment you have anything related to thoughts, still think of schizophrenia. Clear? So classical words, schizophrenia. So next question. A 3-year-old child, a male child specifically, does not make friends. He prefers to stay alone. and likes to play with toys, and parents, they say that the child does not make eye contact. These are very classical words for autism, right? Even in clinical practice, whenever we have to diagnose autism in a child, the very first thing we do is look for eye to eye contact for at least 60 seconds. So we make the child sit and we tell the child, look into my eyes for 60 seconds. And if it is a case of autism, believe my dear students, he won't look even for 10 seconds. So that eye contact is absent. This is very important, is absent. So the child doesn't look into the eyes, or even he cannot look at the face of the examiner. That is absent. And in previous session I told you that there is absence of reciprocal social interaction, right? So reciprocal social interaction is absent, and this eye to eye contact is just a component of that. This eye to eye contact is just a component of that. Like, I am looking into your eyes, you just look into my eyes. That reciprocal social interaction is absent. He is more into attachment with inanimate objects, right? So rather than humans, he is more bonded with inanimate objects like toys, books, right? So this is one important thing. No social mixing up, and loves to play alone. So these are classical words for autism. And of course there is delay in speech. That is one very important feature of autism. And response to voices or sounds is absent. Suppose if the child is playing in a room, and if there is a loud sound, like if something falls down, other people, they will just react, but the child will keep on playing with the toys. He is not bothered about those sounds, and this gives as a false impression as if the child is deaf. So the parents, they will think that the kid is not responding to those loud sounds. Might be he is not able to hear those sounds, so that gives a false impression the child is deaf. And here there is one more important feature, and that is separation anxiety. What is this separation anxiety? It means whenever a kid is taken away from their parents, he will start crying. But a child with autism will not mind this. So this is separation anxiety, which will not be seen in a case of autism. So very classical presentation of autism. So then we'll go on to anesthesia. Okay. So a case of uterine fibroid was planned for hysterectomy, but during pre-anesthetic checkup, it was found that she is having some cardiac pathology. Now, what of the procedure should not be done in such a case? Yes, since he is having cardiac elements, so laparoscopic procedures are contraindicated, right? Clear? Never do any laparoscopic intervention if the patient is having any cardiac ailments. So laparoscopic procedures are totally contraindicated in cardiac ailments, right? So we won't go for any laparoscopic procedure as. Now, another question: while assessing adequacy of mouth opening pre-operatively, only soft palate was visible. And of course, we are doing Malampati grading. So only the soft palate was visible. Now this is very good. This is which type of Malampati grade? So before doing Malampati, before going into the answer, we should understand what actually we see whenever we are doing Mallam Patti grading. Now, you will see the bony part of the palate, hard part. Posterior to that, there is soft palate. Then we can see the uvula and the fascial pillars. Right? So, these are the fascial pillars related to the tonsil. This is uvula, right? And then anterior to uvula we have soft palate. This is the soft palate, which is the part of palate made up of muscles, and anterior to the soft palate we have the hard palate. That is all bony, hard. And now what we do, we tell the patient to open the mouth and we'll check what structures we are able to see. So if you look at the classification, in class 1 we can see all the structures clearly. In class 2 we will see that the fascial pillars are not clearly visible, but uvula can be seen. In class 3 we can see hard palate and soft palate. Uvula is still not clearly visible, and in 4th we will see only hard palate. So if only soft palate with hard palate is seen, this comes out to be class 3. Right? So this is the class 3 of Mallam Patti. Right? So class 3 we can see the soft palate clearly. This soft palate. Uvula is not seen and pillars are not seen. Right? So this is great. Clear? Yes. Intubation cannot be done if cannot open the mouth clearly. Good. Now, proper technique for doing endotracheal intubation. Proper technique for doing endotracheal intubation. For endotracheal intubation, we have to consider 2 points. We have to consider 2 points. One is what at neck. Right? One is neck, and second is atlanto axial. C1. So what we need to do at neck? Neck should be, yes, neck should be flexed, and atlanto-axial joint should be here. So neck should be flexed and atlanto-axial joint should be. So yes, the right answer comes out to be B, flexion of neck and extension of atlanto-occipital. Sorry, atlanto-occipital. Please. Atlanto. Pivot joint is still revolving in atlanto-occipital. So you can see here there is flexion of the neck. Suppose if this is body, there is flexion of the neck and there is extension the atlanto-occipital. Clear? So extension of the atlanto-occipital joint and flexion of the. Please remember this. This is the position for giving or forming endotracheal intubation. Clear? So flexion at neck and extension at occipital. Please correct. Now, next question. A patient was having gunshot injury and is in a hypotensive state, and the doctor planned to give rapid infusion with IV fluids. Now, which colored cannula should be used so that he can give large amount of IV fluid in a short span of time? Yes. Raghu, Neet is yes. So, see, for cannulas, for IV cannulas, you should remember one thing, like size and their number. If the size of the cannula, or what you say, you can say bore or diameter, you can say anything. If the size is more, means if they are wider, the number will be more or less, will be clear. So more the diameter, the number or what you call the gauge will be less. So therefore, if I am saying that, suppose if I am saying about 24 gauge, it means it will be smaller in diameter, and if I am saying 14 gauge, it will be larger in diameter. So there is this thing is you can say inverse, right? So we prefer a 14 gauge cannula, which is actually orange in color, right? So this is orange in here. This is 14 gauge and orange, and see the maximal flow rate for the fluid. So if you want to give a large amount of fluid within a short span of time, always choose a wide bore, wide diameter cannula, so that we can give the fluids at a faster rate, right? So the answer is orange. Clear? And remember this, more the size, more the gauge, lesser the diameter, and lesser the gauge, more the diameter. That, please remember that inverse relationship of the number with the diameter. Now, next question. Which of the following agent is contraindicated in acute intermittent porphyria? Yes, very good, very good. This is thiopentone, and we discussed in previous sessions what is acute intermittent porphyria. It mainly presents with abdominal pain, neuropsychiatric symptoms. Here. Anyway, so in a case of acute intermittent porphyria, yes, very good. Never give thiopentone or barbiturate. Never give, otherwise that will lead to worsening of the symptoms. Yes. Next question. A patient was in early pregnancy and he was taken for medical termination of pregnancy in daycare facility. Which is the induction agent of? Yes, I think everyone can answer this. The moment you find the word propofol, go for it. So that is the IV anesthetic agent, which is the induction agent of choice for day surgery. So this is propofol. Now next question. Succinylcholine was given to a paraplegic patient and that resulted in dysrhythmias, conduction abnormalities, and finally cardiac arrest. What could be the likely? Yes, very good. So this is hyperkalemia, and looking at the conduction disturbances, this is all hyperkalemia. Yeah, especially cardiac arrest. This is because of hyperkalemia. Now the thing is that succinylcholine should not be given in certain circumstances. Number one is, of course, you can say paraplegia, as given in the question. Paraplegia. Second is tetanus. Right? Third is, of course, burns. Right? So already in those conditions where there is possibility of hyperkalemia, never give succinylcholine because that will aggravate the conduction. Right. Right. So this is all clear. So especially in these conditions, paraplegia, tetanus, or burns patient, don't give succinylcholine. Next question. While giving spinal anesthesia, which of the following structure is pierced lastly? Which is pierced lastly? Punit, you need to rethink. See, I am asking which structure is pierced lastly. It means what is that last structure? Once we pierce it, then we are finally into the target space. What is that structure? Very good. Now you're right. Right. So see what happens in spinal anesthesia. Like before giving, okay, before we'll start discussion, let me suppose if we are giving spinal anesthesia in an adult. Firstly, tell me what is the preferred site. What is the preferred site of, no problem, Puneet. What is the preferred site of giving spinal anesthesia in an adult? What is the site? Okay. So say L3 to L4, or somebody might say L2 to L3. Right. So actually what we are doing, because we know that point of termination of spinal cord is L1. Yeah. So, and okay, and what is the target? What actually we target in spinal anesthesia? Anyone? What we target actually? Yes, Raghu, you're right. So we actually target cauda equina. Yeah. We are actually targeting cauda equina, right? And therefore, we always go below the level of termination of spinal cord. So suppose if this is the spinal cord, and then all the nerve roots, they come like this. And since they look like the tail of horse, so they are known as cauda equina. So we wish to deposit the local anesthetic agent in this area, and we want to block the cauda equina. Clear? We don't target the spinal cord. We are blocking the cauda equina, and therefore we choose a site which is well below the termination of spinal cord. So this is in short about the process of spinal anesthesia. Now, as we go from skin to deeper, and the word and where we inject the anesthetic agent, that is in subarachnoid space. So it means the space is below the arachnoid matter. So the answer obviously comes out to be dura mater and arachnoid. Clear? So if we see here in this image, now what you see in yellow, these are all nerve roots of cauda. Here, and this is outer layer dura mater, and just inner to dura mater is the arachnoid mater, and this area in blue is the subarachnoid. Here, so we are injecting the drug into the subarachnoid space after piercing the dura mater and the arachnoid mater. Here, so this is the spinal anesthesia. So this is the last layer which will pierce to enter into the arachnoid. For other things, I have one more question. We will discuss that. Now, next question. Patient became unconscious after giving intercostal nerve block, and it was known later that he developed local anesthesia. Now, how to manage case? So, see, there is one term and that is known as last. Now, what is last? Yes, answer is right. One is right. This is 20% lipid emulsion. Very good. Now, what is last? Last is local anesthesia, systemic toxicity. Right? So, last means local anesthetic systemic toxicity. Because what we presume that if we are giving a local anesthetic to a localized area, it should not go and produce systemic generalized effect. But that is not true. At times there is possibility that patient might have systemic side effect, and it can be in the form of unconsciousness or disturbances of the vitals. Right? So last can occur. And we cannot be very, assured that we are giving local anesthetic, so we won't worry about systemic effects. It can come, but luckily we have this 20% intralipid emulsion, which comes to our rescue in case if last. Clear? So local anesthetic can produce systemic tox. Please remember that. Now, which of the following inhalational agent is given by the use of a spatial vaporizer? Anyone? Yes, Raghu, you are absolutely right. So this is desflurane. Very good. Texic. Yeah. Gulshan. Very good. So this is the Tex6 vaporizer mentioned by Gulshan. So this is the Tex6 vaporizer for desflurane. Yeah. Just remember. Now, which of the following inhalational anesthetic agent has rapid onset of action and rapid recovery, and therefore it is desired for day care, or which is OPD or outpatient surgical procedure? Very good. So this is desflurane. So in terms of intravenous anesthetic agent, we talked about propofol, but in terms of inhalational anesthetic agent, please remember desflurane, which has a very rapid onset and very rapid recovery too. So desflurane. Very good. Yes, it is short acting. Now, a patient who was given halothane for general anesthesia developed rigidity and hyperthermia. And these symptoms are because of which ion? Yes, very good. This is because of calcium ions. And what is this condition actually? What is this condition? Yes, Raghu, calcium. What is this condition? rigidity, hyperthermia. Very good, very good. And this is malignant hyperthermia, not hypo, right? Hyper, right? So this is malignant hyperthermia, and this is because of involvement of calcium. And which receptors? Yes, dantrolene, centrally acting dantrolene is the drug of choice. Which receptors? Which receptors are discussed here? Very good. Adenine, very good. Everyone is right. So you can see here RYR1 receptors and implication of calcium in this process of malignant hyperthermia, particularly halothane. Okay. So this is malignant hyperthermia. Malignant hyperthermia. Next question. A patient was undergoing some surgical procedure under GA, but he developed tachycardia, sweating, hypertension, and tachypnea. So heart rate increased, respiratory rate increased, heart rate increased, blood pressure increased. Now what to do in this case? He is under GA. Now this all presentation indicates that there is light anesthesia. Yeah. So the anesthesia is lighter. So what we need to do? We have to deepen the plane of anesthesia. So this is in short about light anesthesia, and that can, so we need to increase the plane of anesthesia. So deepen the plane of anesthesia. Clear? Next question. So the question I was talking about. Now here I am discussing epidural anesthesia. So this is epidural anesthesia. Now what is the sequence of structure pierced? So as the word is epidural, epi means above. So it means we are going to stay just above the dura mater. We are not going to puncture the dura mater. So yes, everyone is correct, absolutely correct. The sequence is skin, subcutaneous tissue, supraspinous, interspinous, ligamentum flavum, and then we will reach the epidural space. So say this is dura mater, and deep to dura mater will be the arachnoid. So arachnoid, deep to arachnoid we will have the this all will be subarachnoid space. Arachnoid space, and this is all epidural space. Clear? This is epidural space. So we will reach up to this area, epidural, just above the dura mater. And the last one is ligamentum flavum. Now let us see how the structures will be seen. So the very outermost structure is of course the skin. Is skin. Deep to skin will be the fat layer, that is subcutaneous fat. This is subcutaneous fat. Deep to subcutaneous fat is the supraspinous ligament. is supraspinous ligament. Now, supra means there are two words. Supra means above, spinous is actually the spinous process of vertebra. Here, so this is supraspinous. Deep to supraspinous is a ligament which is between the interspinous process, and this is all interspinous ligament, right? This is interspinous. Inter means in between. Deep to interspinous, we have ligamentum flavum. This is ligamentum flavum. And once we pierces this ligamentum flavum, we will be in the epidural space. This is all epidural space, right? And even deep to epidural space, we have the dura mater and arachnoid mater. Dura plus arachnoid, and deep to this we will have the subarachnoid space. See? Subarachnoid. Here. So if we are going for epidural, we will stay just above the dura mater, and this is epidural anesthesia. Now the question is that one is spinal anesthesia and another is epidural. Right? So in a spinal, we are puncturing the dura mater and arachnoid mater as well to reach up to the subarachnoid space. And in epidural, we are just staying above the dura mater to stay in the epidural space. Now, what is the difference between the two types? What is the difference between spinal anesthesia or epidural anesthesia? Which one is preferred? For what reasons? Anyone? So I can just write the points like very good. So duration of surgery, say. See, in a spinal, what happens? Whatever the amount of local anesthetic you have injected, you have to finish the procedure within that time frame of the effect of that local anesthetic. So here the duration, you can say, is fixed. You have to work within that time frame till the effect of local anesthetic lasts. But for epidural, you can increase, so you can prolong the duration of surgery, because through this catheter you can inject a little bit more local anesthetic as in if required, right? Very good, Raghu. So we can prolong the duration of anesthesia. We can, because we can increase the amount of anesthetic agent which has been delivered to that case, as this catheter is left in place. It is not taken out, it is left in place. So that gives us the advantage to give additional doses. Number one. Number two, post-operative analgesia. Like suppose you have done total hip replacement, and then there is possibility that next day patient will have severe joint pain because of the surgery. So through this catheter we can give analgesic agent also. So it gives us the facility of giving post-operative analgesia, which is not possible with spine. So post-operative analgesia, very good. And third is about in terms of technicality, you can say, then spinal anesthesia is simple, a simple procedure. You must have seen most of the people, they are very convenient in giving spinal anesthesia, but it is very epidural is technically demanding, right? You have to have that proper assessment when to stop puncture of dura mater, because you have to stay away that. So it is little demanding, and that needs a lot of practice. Yeah. But from advantage point of view, epidural is far better than spinal, because we can prolong the duration of anesthesia if the surgical procedure is long, and also it gives us liberty to give post-operative analgesic agents. Next question. A child was undergoing squint surgery, but during the surgery there was a sudden fall in heart rate from 140 to 40. As an anesthetic agent, what you should do? Yes, there is a fall in heart rate during ocular surgeries, and what actually this condition is oculo. What is this condition? Oculocardiac reflex, right? And what happens whenever you are, yes, very good, carpal tunnel. So ask the surgeon to stop the surgery for time. So this is oculocardiac reflex, and if you can see, that is the pathway through which there is stimulation of vagus nerve or the parasympathetic efferent, which causes bradycardia. So this is, yes, vagal stimulation. Very good. So this is vagal stimulation which is causing bradycardia. So stop the surgery for some time and let this reflex be abolished. So stop surgery some time. So this finishes anesthesia part as well. We can take a 15 minutes break and then we will continue session. Thank you. Welcome back, dear students. So we can start forensic segment, and the very first question goes like this. There is a victim who is about to die because of some unlawful act. Now, the police recorded the statement of the victim, and the doctor also certified that the victim was conscious and was of sound mind while narrating the incidents. Under what circumstances this dying declaration will become invalid, that is null, and under which of the following circumstances it won't be counted as evidence? So, like if you see here, the person was about to die. The statement has been recorded by police. After confirmation by the doctor that the person who is narrating the incidents is conscious at that time, and he is in proper senses, that whatever he is saying, that he knows that whatever he is saying, and this dying declaration, yes, very good. If the person survives, this will not be counted as a evidence for that against the accused for that unlawful. So if the victim survives, this won't be counted valid. Yeah. So this is dying declaration. Anyone can record the statement. And I think most of you must be knowing what is dying deposition. In dying deposition, the magistrate himself records the statement. And therefore, this carries more legal weight. So this is more valuable. Here, dying deposition. Now this one is dying declaration. Anyone can take the statement. Anyway, so next question. An elderly male was found dead on the road, and it was reported that he might have died due to starvation. Now, when you will do autopsy, what you will? Yes, Nigar, you are absolutely right. The gallbladder will be distended, because if somebody has died because of starvation, then it is presumed that there is no use of the content of gallbladder for a long period of time, and therefore the gallbladder will remain distended. Okay. So if you see a case of starvation death, then gallbladder will be found distended, because the bile has not been used in the process of digestion of fats. So that will remain accumulated within the gallbladder, and hence the gallbladder will be found to be distended. So next question. Any unreasonable conduct or absence of ordinary care by the patient or his attendants, which combines with the doctor's negligence resulting in the injury, and this is known as, I think everyone can answer this, this is contributory negligence. So it means there is contribution, as the name suggests, contributory negligence. So it means both the parties are responsible for the ultimate loss. So there is some deficiency on the part of doctor, right? Doctor is short of the proper care, and also patient is also responsible for not carrying out the orders as given by the patient. So there is contribution from both the doctor as well as the patient in the occurrence of the final injury or the loss. So therefore, this is known as contributory negligence, and this is something good on the part of doctor, because this dilutes the degree of the doctor's negligence. So this is, can be used as a defense by the doctor. So this is contributory negligence. Now, next question. A patient had some unknown poisoning and his skin was greenish color and there was rotten egg kind of. Which poisoning this could be? So here you have two clues: greenish color of skin, but more importantly, rotten egg kind of smell. And yes, this goes in favor of hydrogen sulfide poisoning. Next question. A patient a drug addict presented with agitation and ulceration over skin. There is severe itching and scratch marks on the body, and then there is tachycardia, increased heart rate. There is mydriasis, that is pupillary dilatation, and hypertension, increased blood pressure. Now this could be because of which substance? Yes, so very good, very good. So this itching can be attributed to, you can say, cocaine bugs. So there is tactile hallucinations, and moreover there is increased adrenergic activity. Here, this is increased adrenergic activity, and you can see here there is increase in heart rate, increase in blood pressure, and mydriasis. Right? So combining these two terms, you can very well answer it as a case of cocaine poisoning. Yes, scratch marks, this is because of itching. Very good, very good. Even if this is not given, then these points can be used for acute cocaine poisoning. Clear? Anyway, we have two set of clues, so cocaine is the answer. Now, a female patient presented with extensive burns. She had grade 3 burns on face, neck, or upper part of the body, which is not a proof of inhalational burns. Yes, so what is more important here, that soot particles, so this yellow colored sputum is not an indicative feature of the burns, right? Apart from this, everyone can be related to. A young person was found lying unconsciousness, and a snake was also spotted nearby, and later on the patient died. What can be the reason for death? Yes, this is respiratory paralysis. And respiratory paralysis. Next question. A farmer presented with excessive sweating following consumption of some unknown poison. There is bradycardia, that is reduced heart rate, hypotension, that is reduced blood pressure. Now, what can be used to treat this? Before that, we should answer the condition or which, yes, this is organophosphate poisoning, and which enzyme is inhibited by organophosphate poisoning? Acetyl cholinesterase, right? When this, yes, very good, ACHE. When this enzyme is inhibited, what will happen? There will be increased acetylcholine levels, and therefore we will see cholinergic symptoms. Clear? So we will see cholinergic symptoms, and that is, you can see in the question, there is very good increased parasympathetic activity. So you can see there is excessive sweating, bradycardia, hypotension, all excessive activity. Now there is bradycardia, or even for, like, if you know, for bradycardia we start with atropine, right? So for organophosphate we have to give any drug which is anticholinergic. So we will start with atropine. So this is organophosphate poisoning presenting as cholinergic activity, so give atropine. Next question. Nothing is an offense which is done by a person who at the time of doing it, by reasons of unsoundedness of mind, is incapable of knowing that whatever he is doing, is it right or not. So he cannot be held guilty for the crime, and this rule is actually McNaughton's. So this is McNaughton's rule. Clear? So this can be taken as a defense that the person was not in proper senses, or he was of unsound mind, and he, at the time of committing the crime, he was not in a state to determine what crime I am doing is, whether it is right or wrong. So he cannot be held guilty of the crime. So that is McNaughton's rule. Clear? Next question. During autopsy, the doctor tied the bronchus and checks whether the lung is floating in water or is it sinking. Now, what is this test? Yes, this is hydrostatic test. So, hydrostatic test, and why we do it? What is the purpose? What is the purpose of doing hydrostatic test? You want to check stillbirth or live birth. And then feticide, and then infanticide. So we just want to check whether an infant who has come to us, whether he was born dead or he was born live and then killed. For that we will do hydrostatic test, because if the infant has taken breath, his lungs will be having air in the lungs, and in such cases the lung will float. Clear? Because they have air. So, and this is because of respiration. Whereas if the child is stillbirth, no respiration, and hence no air in lungs, and what will happen? The lungs will clear. So this is the concept of hydrostatic test. And if there is an infant who is dead, and if we are suspecting that he might be, this might be a case of homicide, then we can do this hydrostatic test to differentiate whether it's a case of stillbirth, dead fetus, or case of live birth who was killed later on. So this is hydrostatic. Next question. A child presented in a comatose state after consuming some unknown poison. His skin was dry, pupils were dilated, heart rate high, and the body temperature was raised. I think everyone can answer this. This is Datura poisoning. So you can see dry skin, dilated pupil, raised heart rate, and raised temperature. This is Datura. Okay, so you can remember D's in relation to Datura. One is Datura, of course. Second is dry skin, yes. Then dilated pupil. So please remember this. This is dry skin is actually raised temperature. Next question. Person was brought for autopsy, and relatives, they say that the person was having tattoo marks. Now these tattoo marks are visible because of decomposition. Now what should be the place where we can see the evidence of these tattoo? And this is of course the lymph node. So the ink, it can go from the skin to the nearest lymph node. So even if the ink is not visible on the skin, we can evaluate the nearest, the draining lymph nodes, and we can find the ink there. Look for the ink in lymph nodes. That will be taken as a evidence that there were tattoos in the past. Next question. Elderly male has abdominal pain and facial pallor, blue lines, blood levels are more. I think everyone can answer that. What poisoning is this? This is of course lead poisoning. And what we need to give for lead poisoning? Edita. Give Edita. Okay. So this is typical lead poisoning. And of course, I think must agree that this is one of the unique features of lead poisoning. Yes, Burtonian line on gingival tooth border. Right? Lead poisoning. Next question. A female faked pregnancy and presented as her own child after a few months to blackmail her boyfriend. This is this is supposititious child. Okay, this is supposititious child. So here the lady will take someone else's child, and then she will claim that this is my child and such person is the father of this child, and then she will ask for some share in the property or anything. So this is just to blackmail. Right? So this is supposititious child or faked pregnancy, and this is with some ill intent. There is some ill intent, and although the lady is not the biological mother, she has taken the child on, you can say, on rent for some time. Now what is this Spurious child. What is this spurious child? What is spurious child? Yes, we can discuss the spurious child. Anyone? No, Raghu. That is different. We will also take this posthumous. Anyone? See, spurious. Actually, this word child should not be there, and this should be actually pregnancy. Because what happens? The lady thinks that she is pregnant, right? Because she have, amenorrhea, abdominal distension, or you can say nausea, vomiting. So she may have all the features of pregnancy, and she might think that I am pregnant, but in reality she is not pregnant. So that is spurious pregnancy, right? So the child, the lady is thinking that I am pregnant, although in reality she is not pregnant. Right? So this is spurious pregnancy. Then superfecundation. What is superfecundation? Superfecundation. Superfecundation. There is one cycle, 2 eggs, right? And both are fertilized by different acts, right? So you can say it can be because of 2 different person or same person having that at different period of time. But the thing is that one cycle, 2 eggs, 2 separate acts. So this is superfecundation. And now the word superfetation. In superfetation, the lady is already pregnant here, and in next cycle, ovum is fertilized that. So superfetation, lady is already pregnant, and then pregnancy over pregnancy, you can say this. And superfecundation, in the same cycle, 2 different acts to fertilize 2 different eggs. So this is superfecundation and superfetation. Now another term is posthumous child. And posthumous child born after the death of father, biological father. So it's like maybe some, you can say some army person whose wife was pregnant, but then he was killed in some militant act or something like that, or some police person. So then the child is posthumous child. Then another is, one more word is atavism. What is atavism? Atavism, child resembles grandparent, maybe grandfather. So rather than resembling the father or mother, the child is resembling the grandfather or grandmother. So that is atavism. These are few words which are related to this topic. Anyway, next question. A 14 years old girl has been, she is a rape victim and presented with 22 weeks of gestation in the hospital. What is not true? What is not true? Yes, the age is 14 year. The age is 14 year and consent is invalid. So the doctor cannot abort if the patient requests. The consent is invalid here. Parents' consent taken. 14 years of age and of the patient doesn't hold any value. Next question. Chronic alcoholic has stopped drinking alcohol since last 48 hours. And now he is having visual hallucinations and tremors. I think now everyone can answer this. He is disoriented, talking irrelevantly. I think everyone can answer this. Delirium, tremors. Right? So again, you can remember like disorientation is one of the feature of delirium. Related to this word, you can remember tremens. And a chronic alcoholic who is taking years on regular basis and has stopped suddenly and within nearly around 2 days time, he will have all these presentations, visual hallucinations, irrelevant talking, all goes in favor of delirium tremens. Right? So this is classical for delirium tremens. Next, cause of death in judicial hanging is a method of execution. Judicial hanging, yes, this is fracture cervical vertebra axis, may be involving odontoid process of axis. So this is involving fracture of upper cervical vertebra, especially C2, or this is like what we say hangman's fracture. Hangman fracture, yes. Remember hangman's. Yeah. Pratyusha, you are saying UPT. Okay. Right. So hangman's fracture, especially involving C1, C2, but more importantly, it fractures the cervical vertebra too. Now, next question. Common finding in a case of strangulation or low level partial. See, here you have to entertain both these conditions: strangulation, hanging. Yes, if we know the definition of partial hanging, some part of the body touches the ground, that is partial hanging. Yeah. Yes, and you know, especially in cases of strangulation, what you see? Transverse ligature. So, transverse ligature mark, especially know about strangulation. manual strangulation. Right? So this is enough for forensic, and post lunch we will take last subject of this session, PSM. So see you after the lunch break of 45 minutes. Thank you. Hello dear students. So welcome back to the things after the break, and now we are into the last subject of this PYQ series. So we can start with the MCQs of PSM. So the first MCQ is about the duration of use of barrier contraceptives after vasectomy. So if person has undergone vasectomy, he needs some protection, use of barrier contraceptives, and that should be given for at least 12 to 16 weeks after the vasectomy so as to avoid conception, right? So need to give additional protection, barrier contraceptives, for about 12 to 16 weeks after vasectomy, right? So the next question, a rapid mass screening method that can be employed by the paramedical workers to detect malnutrition in preschool children of the age of 1 to 5 years children. So to check malnutrition in school going children's, very simple and very feasible method which can be carried out by even by paramedics, and this is very good. So mid arm circumference, and sometimes you might have this word, that is mid upper arm circumference, mid upper arm, it's the same thing, mid upper arm. Yeah, so very easy and very important procedure. So moving forward to next question, a person from West Bengal presented with diarrhea, and he is having ascites, and more importantly he is having ascites and edematous extremities, and on investigating it was found that he was using mustard oil which was brought from some local store. Now what actually this condition is? Yes, this is epidemic dropsy, and this epidemic dropsy, is principally the main presentation is ascites or pedal edema, right? That is very important here, and this is because of adulteration of mustard oil with arginine oil. Is adulteration of arginine, mustard oil, yes, mixed with arginine oil, and yes, you can see this is a classical picture where you can see pitting edema. This is epidemic dropsy, adulteration of mustard oil mixed with arginine oil, presenting with edema. Next question, which stage of demographic cycle has the highest birth rate? So which stage? Yes, very good. So highest birth rate is seen in two stages, stage 1 and stage 2 also. So in both the stages the birth rate is highest. After that it starts declining, right? So if you see by this green, this is birth rate. So highest in stage 1, and after 2 it starts declining. Highest in stage 1 and stage, in stage 3 it will start declining, something like 1, right? Highest in 1 and then clear, highest in stage 1, right? Now, which of the following is not indicated in managing a case who, consequent to consumption of arhar dal, which is adulterated with kesri dal, developed some problem. Now, what is the condition which is discussed here? Which condition is discussed here? The clinical condition, which is consumption of, very good, consumption of arhar dal with kesri dal. This is neurolathyrism. Very good. So the condition is neurolathyrism, and there is no point in giving diethyl carbamazine, right, which is given for case of filariasis. Clear? So there is no point. Yes, and the toxin is OA. Yeah. So this is, you can see, neurolathyrism. Neurolathyrism. Yes, parboiling will remove. Next question. Which of the following is not included in RCH program? Reproductive and child health. Which of the following is not included in RCH program? Okay. Can you think of anything better? This is also not a component of RCH here. So C seems better. B. B can be also considered, but C is okay. So reproductive and child health, mainly focusing on the lady as well as the newborn. So C. Next question. A person has poisoning after consumption of groundnuts which were stored at its house for long. Now what can occur because of this? Yes, so the moment you see the word groundnuts, always think of aflatoxins. Very good. So aflatoxicosis, right? This is aflatoxin. Now, which of the following is not used for checking quality of pasteurization of milk? Which of the following test is not related to checking the quality of the pasteurization of? Yes. What is the purpose of doing orthotolidine test? Orthotolidine test is done for estimation of, yes, very good, for free and combined. Okay. So orthotolidine test has nothing to do with milk, it is related with water. It is related to. Now, can you name any condition which can be which can develop because drinking of unpasteurized milk, any condition which can develop because of drinking of unpasteurized milk. Yes, Pratyusha, you are right. Option A, B, C is A. Any condition which develops because of consumption of unpasteurized milk. Brucellosis, very good. So one entity is brucellosis. Please remember at least brucellosis, and the classical presentation for brucellosis is PUO, pyrexia of unknown origin, and the fever will come and fever will go, right? So that is, anyway, so this is the assembly of orthotolidine test for free and combined chlorine estimation in water. Next question. A study was conducted on 1300 autistic childs and 3000 healthy child of the same age group, and it was conducted to check any association with measles vaccination. So from both the groups, a history of measles vaccine was taken, but after the study we found that there was no association related to the vaccination with autism. So one group with autism and another group healthy children's, and then history of measles vaccination. So this is case control study. Okay? This is case control, disease versus non-disease. Case control. A medical officer examines mine workers, and many of them were having silicosis. Now, what should be the advice for these patients? Yes, for these patient of silicosis, there is possibility of developing TB at some moment of time, so they should be evaluated for tuberculosis, because we call this silicotuberculosis. Yeah, so there is possibility of tuberculosis, and therefore rule out or evaluate them for tuberculosis at regular, especially in mine worker. Next question. Preferred bacteriological indicator of fecal contamination of water. Preferred bacteriological indicator of fecal contamination of water. Yes, E. coli. Right? And yes, ideal is E. coli count we should be 0. Clear? So that is the ideal sample. So E. coli. Now I think everyone can answer this. Orthotolidine test checks. Orthotolidine test checks yes, I think everyone can answer this. Free and combined chlorine, we have already discussed this. So orthotolidine test, free and combined chlorine. Next question. Best method to explain the procedure of wound cleaning after animal bite. So you want to teach community about certain procedure it's better you demonstrate them. Right? So demonstration is always a better way to teach public about any procedure as such. It can be wound cleaning, or it can be, yes, ORS making, anything. Yes, demonstration is perfect. So you just show the steps how that particular thing is done. ORS preparation. Now, under National Polio Eradication Program, if there is a case of acute flaccid paralysis, what is not true? So we discussed yesterday in previous session about acute flaccid paralysis, like following fever, there is lower motor neuron type of palsy. So that is acute flaccid paralysis in a child. And if we want to label it a case of polio, which of the options are not true? Yes, Chiki, yes, Nidhi, you are right. That, see, if we see a case of acute flaccid paralysis, he is called for follow-up after 3 days. Right? Follow-up has to be done after 60 days in a case of acute flaccid paralysis. Right? So it is not 30 days, it is 3 days, and therefore option D is wrong here. So that time limit is 2 months, not 1 month. Okay? Then only we will say that the given case of AFP was actually a case of polio. Yes, so 60 days follow-up. We have to call the child again after 60 days. A female patient has vaginal discharge. What kit number with what color you would advise? See, this is lady with vaginal discharge. See, this is kit 2, green in color. Okay. And vaginal discharge, what conditions we discuss? Bacterial vaginosis. Then trichomoniasis. The third condition is candidal moniliasis. Here, so these are the 3 conditions, and we gave only 2 drugs. So what are the 2 drugs? For these 2, we gave sacnidazole, and for fungal contains gluconate. Clear? So in the kit it is sacnidazole. Although in clinical practice we prefer metronidazole, but here we keep sacnidazole, right? So this is kit number 2, which is green in color, and that is given to a lady with vaginal. Clear? Next condition. Next question, sorry. Number of live births per 1,000 women in women who are in reproductive age group is labeled as. Reproductive age group means 15 to 45 years. This is the reproductive age group. Yes, the answer is GFR, general fertility. Total number of live births per 1,000 women in the age group of 15 to 44 years. Now, a male patient presents with urethral discharge. What kit number, what kit color? Urethral discharge in male. I think this is kit 1, which is gray in color. And which conditions are covered here? Gonococcal, and the second one is non-gonococcal, is actually remedial. Clear? And what the drugs we use? Exim, and for non-gonococcal it is mycin. So this is the composition in kit 1, which is gray color, for urethral discharge. Yes, perfect. Okay. This is kit 1, gray in color. Now, first peripheral contact center to village people in medical health care. What is the first contact center for village people? Yes, this is sub-center. So for the rural population, the very first contact center is sub-center. Right. Now next question. Which is not true regarding community health center? Which of the following statement is not true for community health center? Which of the following is not true for community health center? Yes, in community health center, there is no concept of treatment of genetic, congenital conditions, or you can say super specialized services. So for this, we need super specialized services. That is not thing which is done at the level of CHC. Clear? Treatment of genetic or congenital condition. Now, which of the following is used to plot trends of a diarrheal disease? You just want to show the number of cases, month wise or year wise, you will go for line chart. Yes, so you will simply, like if you are going, this is actually date wise, in this one date, second date, third date, fourth date, and then you will, this is the number of cases here, this axis is number of cases, and this is the time. Then you will mark the value, and then you will connect it by lines. This is the line chart. So these lines are connecting the values corresponding to the number of cases with respect to time frame. So this is line chart. Here. Now, which of the following is the first referral unit? First referral unit. Yes, very good. So community health center and district hospital. These are the first referral units. Yes, Pratyush. So first referral unit is CHC and district hospital. Now, which of the following is not considered while calculating maternal mortality rate? Which of the following is not calculated or considered in the numerator while calculating MMR? See, the term is maternal mortality, right? And this is related to the obstetrical conditions. So there is no concept of inclusion of the death which have occurred because of road traffic accident. Yes, RTA or any other mishappening is not included here. Can be included electrocution or any other unnatural death not related to obstetrics. Right? So this is road traffic accident deaths will not be entertained while calculating MMR. A female health worker goes out into the community every 15th day and she want to collect data regarding malaria. Now this is what type of surveillance? This is active surveillance, right? And what is the word surveillance? What is surveillance? surveillance, you can say scrutiny, right? And yes, this is in PSM, it is to detect hidden, missing. Clear? This is active. She is going outside and she is collecting the data about the number of cases of malaria. So this is surveillance, scrutiny of diseases. Now, a 30 years married female who has studied till 9th class, has good communication skill, and she is from one village. Now, can be appointed as, I think everyone can answer this. This is ASHA worker, that is accredited social health activist. ASHA. ASHA. Next question. Ticks or bugs, they are present on the surface or are attached to the clothing. Now, what is this? Infestation. Very good. So, this is infestation. And any example of infestation? Infestation. Any example of infestation? In terms of pediculosis. Pediculosis corporis is body louse. Okay? And what happens? These are mainly present over clothes, right? Rather than on the body, they are present on the clothes, and therefore treatment is of the clothes, not the patient. Here, so here we treat the clothes, so we can wash them in warm water, right? Or sun dry or ironing. So this is actually infestation. Yes, right. So this is infestation where the parasite, it resides on the clothes, and therefore the treatment of patient as such is the treatment of clothes more than the treatment of the patient itself. So this is a classical example of infestation. Clear? Now, on World Health Day, an awareness program was conducted in a hospital. So the CEO of the hospital welcome everyone and then introduces the topic, and yes, very good, 7th April, and he introduces the speakers also. Those speakers, they were sitting on the stage and they started putting their views about that topic one by one. What is this known as? This is panel discussion. You can see there is a panel of experts who are onto the stage and they present their views one by one. So this is panel. Clear? Panel discussion. There is a panel which sits on the stage. Now, in case of natural disaster, since we have limited resources for management, so what we do, we categorize the patients as per their priority of treatment or their chances of survival. Now, this is known as triage. Okay? So we categorize the patient, and based on that we decide which category needs urgent attention and which can be delayed or which doesn't need any attention at all. So this particular classification is known as triage. Right. Now, if there is a head-on collision between two buses where we have some people, some who are dead some were severely injured, some were moderately injured, and some were mildly injured. Now, if you want to categorize them as per the order of severity of their injury and their urgent attention, what will be the sequence of categorizing them or putting them under triage from high priority to low priority? High priority to low priority. Yes, the red ones are the ones which need top priority, and the black ones are the one which does not need any attention, because what are the ones in this black category? They are the dead or moribund, right? Moribund means about to die. So we don't need entertain those patient. So black is always at the last and red is always as the first priority, followed by yellow and green, right? So this is the sequence. Yes, moribund, about to die. So this is the sequence: red, yellow, green, and black. So this is red, yellow, green, and now, as per biological waste management, metallic body implants should be discarded in biological medical waste, metallic body implants. Yes, very good. So this is in blue color, right? So metallic implants will go into blue color. Yes. So here, if you can see, the metallic body implants will go into blue color. Now, plastic tubings, Eurobag catheters, they should be disposed in which color? Plastic tubings, Eurobags, catheters. Remember, yes, this is red. Okay, so red bag, plastic tubing, Eurobag, catheters, all will go in red. Incineration is the method of disposal for waste. Incineration, yellow, yes, right. And what does yellow bag contain? What is the content or what is disposed in yellow bag? What is disposed in yellow bag? Very good. So this is human anatomical waste like placenta or amputated body parts. Clear? Apart from this, anything infected with human blood yes, it can be, dressing gauze. Yeah. So these all will go in yellow bag. So either any part of human body or any substance like dressing, it can be dressing, which is contaminated with human blood. So everything will go into yellow bag, and yellow well will be subjected to incineration. Clear? So this is for yellow bag. Now next question. You are a medical officer and you want to train some A&M workers for vaccination. And you want to see whether she is following the biomedical waste rule or not. So which of the following seems correct to you? Yes, I think it's very basic. If there is a needle, it should always go in translucent white container. Okay. So this is actually puncture proof. Needle, scalpel, they should be in. And yes, this is one thing, if it is only needle, and if it is syringe plus needle combination, then it will also go into the translucent white container. Anything metallic, pointed should be into translucent white container. Clear? Now, what is the interest of UNICEF? UNICEF works or focuses mainly on child health. UNICEF works more for child. Which of the following is used to kill the larva of mosquito? Larva of mosquito, Gambusia fish. Okay, so this is Gambusia. Everyone is correct, or larvicidal? Larvicidal. Next question. A patient presented to the OPD with eschar and lymphadenopathy following a bite from mite. What condition is this? Eschar, lymph node enlargement, mite. Yes, very good. This is scrub typhus. So you can see here, this is post-auricular region, because here you can see lymph node enlargement, and this is here. So post-auricular lymphadenopathy with eschar. This is scrub typhus. Very good. Now, what is the correct statement for case control study? Case control study. Yes, of course, we use it for studying rare disease or disease of our choice. We want to whatever this, yes, and this is not cause to effect, this is effect to cause. We go backward, right? So we go in the past. We have the patient, effect is actually disease. We have the patient with disease and we want to get to know the reason or the etiology. So this is cause, this is effect, right? This is effect, cause. Cause to effect is, of course, what? Clear? So this is, answer is option A. Clear? Cause to effect is cohort and effect to cause or what you say, perspective. So next question. I think this we have already discussed. Highest priority is for red. Is red, highest priority. Next question. A lady forgets, a lady who is on OCP forget to take 2 pills in the 3rd week. Now, what you will suggest? She is on OCP and she forgot to take 2 pills. So, what should be done? Yes, we will tell her to continue the medicines, to continue the OCPs, but since the efficacy has reduced, so we need to make sure that there is some additional protection in the form of barrier contraceptive has to be taken, right? So continue the OCPs and add some additional protection in the by the way of barrier contraceptive. Continue the tablets and take barrier contraceptive. Next question I think is very basic. Anemia Mukt Bharat program for a 26-week pregnant lady. What has to be given? What dose of iron and folic acid has to be given? Yes, once a day prophylaxis. Yes, and this is 60 milligram elemental iron and 500 microgram folic. Okay. This is 60 milligram elemental iron and 500 microgram folic. Okay. In a field visit, a child was found to have swelling on the face and swelling over the scrotum, and he cannot chew properly or open his mouth. I think this has to be very basic MCQ. This is mumps. There is carotid gland inflammation, and there is bronchitis. Clear? This is mumps, bronchitis and parotitis and mumps. Which of the following is true for Kuppuswami's scale? Kuppuswami's scale. Kuppuswami's scale. One of the component is education. Then income, and third one is occupation. Very good. So third one is, and you can correlate occupation with income, and you can correlate education with occupation. Right? So like if education is good, he will have a good occupation, and if occupation is good, he will have good income. Right? Education, occupation, income. Remember this sequence and you will be never wrong in your answer for Kuppuswami's scale. Clear? Burden of disease estimation. Burden of disease estimation. Yes, anyone? Delhi, yes. Disability adjusted life years, Delhi. And maximum Delhi is for psychiatric orders, especially depression. Right? So this is disability adjusted life years, maximum for psychiatric disorder, depression. This is estimate of burden of. Now, I think this is a very basic question, and you must have already heard about this term as such. So a healthy person came in contact with a known case of COVID-19. Now we have separated this person from others for a period equal to the duration of incubation period of COVID-19. Now, what is this? Yes, I think most of you know it is quarantine. Right? So, in quarantine, we separate normal person, and this period is equal to the incubation of the disease in consideration. Clear? So that is quarantine. Whereas in separation, we separate, whereas in isolation, I'm sorry. So in isolation, we separate the patient. So here the patient is separated from normal people, and we want to prevent disease transmission. Clear? So that is the difference between isolation and quarantine. In quarantine, the normal person who has came into the contact with the diseased person has been separated till the period of incubation period, and after this incubation period, if there are no symptoms, we will say that the person is not infected. Clear? So this is quarantine, and isolation is of subjects of the cases, like we will isolate the cases of tuberculosis, like that. Isolation is of. Next question. In a family of 6, there are 2 parents and 4 children. The youngest child catches measles infection. Parents are immune, they cannot have the measles infection, and then on day 3rd and day 5th of the infection of the first child, 2 more children developed measles. What is the secondary attack rate? Now, for calculation of secondary attack rate, you have to, the denominator is, what is the denominator for calculating secondary attack rate? Any idea? What is the denominator for calculating secondary attack rate? Yes, anyone? Total number of susceptibles. Okay, no problem. Total number of susceptibles, and what will be the numerator? Any idea? What will be the numerator? Yes, Nidhi, that is the denominator. Total number of susceptibles or contacts, and numerator will be the number of, it will not be number of new cases, it will be number of cases developing from primary case, right? So how many cases are getting infection from the primary case? That is the numerator. Now, if we go into the question proper, there are 6 people, 2 parents, 4 children. Right? Now, the parents are immune, so it means they are not susceptible. So, they will not be counted in denominator. Will not counted in denominator, okay, at all, because they are immune, they won't be counted in susceptible. Now, out of 4 children, 1 children got the infection, right? 1 children got the infection, so that is the primary case. Now, how many are left? 3. Okay, so these 3 are the total number of susceptibles, and this is actually the denominator here. Clear? So denominator will be 3. Now, how many cases got infection from this primary case? 2. 2 more children got infection, so they are the, this is the numerator. Here, this is 66. This is how you will calculate secondary attack rate, right? So we have to see how many persons are susceptible after excluding the primary case. That will give you the denominator. Okay? So that will give you the denominator, and then how many cases have developed from the primary case, that will come out to be the numerator. So this is how you should calculate secondary attack rate. So that word is secondary, it means cases developing from primary. How many cases have taken infection from the primary or the main case, or primary, or in simpler words you can write first case. Okay? This is secondary attack rate. Next question. A well of contaminated water is resulting into epidemic of acute watery diarrhea. Now, what kind of epidemic is this? What kind of epidemic is this? See, there is a well, and this will be used by community people, right? So, of course, this is the common source. Everyone is coming here. But these people, they will come almost daily to fetch the water. So, this is continuous exposure, right? It is not like they will come once, they will drink, and then they won't come back. They will keep on coming. So it is a type of continuous exposure. Common source, continuous exposure. The answer will be this. Suppose if the problem is occurring only at once from a common source, it will be point source or single source exposure. Like if there is some gas leakage, like the classical example is Bhopal gas tragedy. So whosoever in the community is surrounding that plant, that will be affected, but at once, not daily or on a long term basis, just once. So that is single exposure, right? So if the condition is occurring once, single exposure. If it is occurring daily or longer time, then continuous exposure. So this is common source, continuous exposure. Now next question. Which is not true for taking a decision for screening a disease? So, I mean, we are considering a screening test. We are discussing about a screening test. Yes, Raghu, are you absolutely right? A screening test is okay if it have high false positive. This is okay, right? But if false negative are high, this is acceptable for a screening test, right? But if he is showing high false negative, then it is unacceptable, right? So this is totally unacceptable if the test is showing false high negative. Now, what does we mean by the word false positive, false negative? Now, what does this word mean? False positive means, suppose we are taking a test for, just for example, if we are taking a test for disease A, right? If we are doing screening test for this condition, there is possibility that disease B might show the test positive. So this is known as false positive. Some other disease is showing the test positive, which we are not had taken into consideration, right? So we are looking for disease A, but there is some disease B which is also giving the test positive. So the test is coming out to be the positive, but it is not for the entity for which we are looking for. So it is false positive. Now, what does false negative means? The person is having disease A, but the test is negative in a patient of disease, right? So this is wrong. Patient is having the disease, but the test is not detecting it. So this violates the principle or the, or the motive of a screening test. Screening test has to be positive for disease A, and if it is also positive for disease B, no problem, but it has to be positive for disease A always. It has to be positive for the disease in consideration. So false positive is okay because it is positive for disease A and it is also positive for disease B. So no problem. But it shouldn't be the case that it is negative for the disease for which we are using that screening test. That violates the principle. So this is never acceptable. False negative is not acceptable for a screening test. Okay, next question. Secondary level of prevention. Secondary level of prevention. See, secondary level of prevention is what? Early diagnosis and treatment. Clear? So this is early diagnosis and treatment. Now, which of the following option goes for that? Of course, early diagnosis. So this is for early diagnosis of carcinoma. Clear? So pap smear, the secondary level of. Now suppose what for option A? Prophylactic drug, like if somebody is going to malaria endemic area, what is this prophylactic drug administration? This is which level? Primary. Very good, because we are giving specific protection. Now what about admitting? No, this is, I think, tertiary. This is disability limitation and rehabilitation. Clear? And what about vaccination? Vaccination. Yes, vaccination is primary because this is again specific protection. We are giving vaccine to prevent child or a person from a specific disease. So that is specific protection, right? So early diagnosis, screening test, diagnostic test, everyone will come in secondary level of prevention. Now, assessment of sputum of a TB patient, which level of prevention? Assessment of sputum of a TB patient is which level of prevention? Yes, I think everyone can answer it now. It is secondary because we are going for early diagnosis of TB. Right? So this is second. Great. So this is for diagnosing tuberculosis, and anything which goes for diagnosis has to be secondary. Patricia, see, primary, what is actually primary? Risk factors, of course, present, but disease is absent. Okay. And we want to make sure that the disease does not happen. So what we can do? So we want to prevent the occurrence of disease in primary, and that can be done by either promotion, that can be done by specific protection. Specific protection can be by vaccination, something specific related to any disease like hemoprophylaxis. Clear? So in primary, we don't go for any test or any diagnostic method. We don't apply that in primary. It all comes in secondary. When we fear that the disease might have occurred, then we will go for secondary. So we will go for diagnosing the disease first, and if it is diagnosed, we will try to treat the disease so that the complications are minimized. Early diagnosis, treatment to minimize the complication, right? So this is primary. There is no test. Okay, great. Next, in an endemic area, you are planning for a vaccination to immunize the people against one particular disease. So I think everyone can answer this. Yes, this is vaccination, which is a primary level of. Great. Vaccination, primary. Any test, maybe screening or diagnostic, secondary. A study was conducted by a research team where they tried to assess the effect of alcoholism on divorce. So what they did, they made two groups. One is divorced, another is non-divorced, and then they went into the past and they asked whether they took alcohol or not. So this is what kind of study? Divorced, non-divorced, then going into the past and checking for history of alcoholism. So what study this is? I think yes, very good. This is case control study. This is case control study. We have two groups and we ask about this is retrospect. Going into the next question. A camp was organized for peoples who are above the age of 40, and we checked blood pressure and blood sugar because we want to check how many have hypertension, how many are diabetic. Now this is which level of prevention? hypertension and diabetes mellitus. There should be no confusion in this. The moment you see we are testing for any disease, right? Testing for any disease, it can be invasive, it can be non-invasive. So that has to be always secondary. That has to be always secondary. Clear? So testing, it can be invasive, like we are doing blood sugar estimation here. It can be non-invasive, like we are checking for blood pressure. So any test for any particular condition is secondary. Clear? One more question just to help you out in understanding case control and cohort study. An epidemiologist want to study association of depression, right? So you want to study the effect, the association of depression with the use of social media in the past. So what he did, he made two groups, depression and non-depression, and then he took past history of use of social media. Which type of study is this? This is, of course, case control study. Now here I will just explain the things again. One group is persons with depression, right? So this is a case group. Case means the persons with the disease or problem in consideration. Whatever the problem we are evaluating, that will be the case group. Then we will make another group which will have normal persons with same features. It means here no depression. Now we will ask about history of social media use. Clear? So we will ask in both the groups that whether you have, so we are taking a past history, and then again it can be plus minus, it can be plus minus. So based on that, we will be looking for a association, whether really social media is a cause for depression later on. So this is case control study. So to understand what case control study is, that like here you are going into past. One important keyword to understand this is that you are going into past, right? So from current you are going into past, you are taking past history. The moment you have this kind of word, past history, previous history, this is a case control study. Right? Past history is very important component in case. The moment you find this word, think of case control. Just one more question to make your concept clear. Now, epidemiologists want to study the relationship between online food and the development of obesity, and he want to use case control study method. So what he will do, what groups he will make? Obviously, whenever we are doing case control study, we have to make two groups. One is diseased persons, this patient, and second group is non-diseased or the normal person. Always they should be matched, same area, same age, same gender, like that. So matching has to be done. And then what we will do, we will take the factor under consideration. So here the factor is online food. So diseased person here is obesity. Now non-disease means non-obese. And what we are going to ask, we will take the history of online food, right? So this is case control because we are taking a past history of online food. We are asking about the past history of online, right? whether he had ordered for online food or not. So this is case control study method. Again, if someone want to calculate the incidence of deafness, if someone wants to calculate the incidence of deafness among factory workers because of factory machines for few hours of working, what study he will look for? Yes. Now here the word used is incidence. And what does incidence mean? Incidence means new cases. And new cases can be achieved only if you go for cohort study. Right? So what we will do, we will make two groups here, right? So group 1, group 2, and then group 1 will be exposed group and the second group will be non. Right? Now what is the exposure here? Factory machines. So this is exposure to factory machines here, and the second will not be exposed to factory machines. And after some years later we will check the deafness. We will check the deafness, how many have developed. We will look for deafness plus minus, and here also deafness. So what we are doing, we are going into future. Maybe like we have conducted a study in 2024. Maybe we will take the result in 2034. So we are going into future. So this is a classical cohort study, and here only we will be able to say how many new cases had come. Right? So incidence, new cases after some time, this is cohort method. Okay. Now next question. A new drug does not prevent a disease from occurring, does not cure the disease fully, but reduce death due to that disease. What is true? Okay. What is true? So there is a drug, does not prevent occurrence. It means very good. So if a drug is not preventing occurrence, it means incidence is unaffected. Clear? So incidence is unaffected. That is the number of new cases. Number of new cases remains unaffected. Incidence same, unaffected. Very good. Now what is happening? It is not curing the disease fully. So not curing the disease and reducing the death. So what will happen? Not curing or not preventing death. So it means what is happening? Whatever the number of cases has once developed, they will remain as such. So whatever the number of cases once has developed, they will remain as such. So from a society, this is actually old cases, right? It means the number of old cases will keep on increasing, right? So number of old cases will keep on increasing, and if we take the number of old cases is defined as, what is this? Is prevalence, which is old plus new. So new will come regularly, but old are increasing every time, so it will lead to an increase in prevalence. Right? So once a case, it is always a case, because that drug is not curing, neither it is leading to death of the patient. So that patient will always keep on collecting in the pool. So therefore, the old number will increase, and prevalence, which is the sum of old plus new, will increase, because new are unaffected, they will come, but old are not reducing, they are also increasing. So overall the prevalence will increase. Clear? This is how you need to tackle such questions. Now just another question based on the same concept. A condition is very fatal and there is 100% fatality. Now what will be the equation or the relationship between incidence and prevalence? Let us again take the concept of incidence and prevalence. Incidence is new cases, right? Prevalence is new cases plus old cases. So whatever the new cases are here, they will be added into the prevalence. Moreover, the old cases which are present in the society, they will also be calculated. Now, old cases means what do you mean by the word old cases? Old cases are the ones which have the disease, right? So it means they are neither cured nor killed. Clear? That will be the definition of old case, neither cured nor killed. Now what is happening here? The condition is very fatal and it is killing all the patients whosoever are getting the disease. So here the old cases, what will happen to the old cases here? Old cases will be 0, because the condition is killing 100% killing power of the disease, and therefore there is no concept of old cases for this disease, because once a case it is going to die. So there is no concept of old cases. So whatever the new cases are there, they are the ones which will be existing in the society, and therefore incidence will be equal to prevalence. So incidence and prevalence will be same, because old cases are not there in the society. So whatever the new cases are there, they will be considered only in prevalence. Clear? So incidence will be same as prevalence. Clear? Old cases 0. Yes, right. So that is how you can tackle this kind of question. Now what is this lethality or severity of a disease? What is this? We also call it killing power of a disease. Very good. This is case fatality rate. How many patient develops the disease? From that, how many dies? That is case fatality rate. So taking another question for case fatality rate, what is the wrong statement for case fatality rate? False, wrong statement. Yes, what is the denominator? In case fatality rate, the numerator is number of death from that particular disease. Clear? Right? Suppose if you are taking, say, measles, so number of deaths because of measles, and you can write measles here, and what will be the denominator then? Denominator will be total number of cases of that disease, and here we are taking measles, right? So the denominator is total number of cases and the numerator is how many people, how many patients from that total number have actually died. So that becomes the numerator. So therefore, this is a kind of proportion because the numerator is a part of denominator, right? So this is a kind of, so number of deaths upon total number of cases. Clear? So this statement is wrong. Mid-year population has nothing to do with the calculation of CFR. Now, which is contraindicated in pregnancy? Which vaccine? Which? Yes, yellow fever being a live vaccine is theoretically contraindicated, right? But it can be given if need rises. Clear? So being a live vaccine, it should not be given. That's very straightforward. But practically, if we see that we have to give it, then we can consider giving it. Otherwise, theoretically, all live vaccines are contraindicated in pregnancy. Next question. At the end of immunization session, you find reconstituted BCG vaccine with 2 doses left in it. Now, what you will do? Very good, very good. So, see, the purpose of reconstituted vaccine is that is like purpose of reconstituted vaccine is that prepare them when you need to administer, right? So there is no concept of preparing and storing. There is no concept like that. So whenever you want them to give, prepared at that time, and if anything remains in the vial, discard, right? So don't use it after a certain period of time because that is not advocated, right? So reconstituted vaccine has to be used within, yes, for BCG it has to be used within 4 hours, otherwise discard it. So we are considering the remaining dose after the end of an immunization session. So we are presuming that almost 4 hours have already elapsed, right? So there is no sense in keeping the vial with us. So discard the vial. At birth, yes, BCG, HB, B and OPV. Yeah, yes, everyone is correct in this. Very good. Now, an ANM receives open vial of MR vaccine and open vial of pentavalent vaccine. What she should do as per the open vial policy? So part of this we have already discussed. Yes, pentavalent vaccine can be used, but reconstituted vaccines has to be discarded if they are not used for a certain period of time, right? So pentavalent can be used again and again till the doses are there in the vial, but that doesn't hold true for MR vaccine or BCG vaccine. Clear? So use pentavalent, discard MR. Oblique spot, I think everyone can answer that. This we have discussed numerous times. Oblique spot for measles. Rabies free In India, this is Andaman and Nicobar. Very good. So rabies free state in India is Andaman Nicobar. Now with international certificate of vaccination for yellow fever, what is the time period after which the validity of certificate begins post vaccination? Yes, this is 10 days. So suppose if someone is vaccinated on 20th, the consideration will be from 30th onwards, and it will be till lifelong. Right? So validity starts 10 days after vaccination. Here, this is for yellow fever vaccine. 10 days post vaccination till lifelong. Window period for HIV. Window period for HIV. Can be up to 3 months, right? It can be up to 3 months. So 2 to 12 weeks. That is very long. Can be up to 3 months. On an average, you should remember 3 months. Okay? Keep this in mind. Window period up to 3 months. Okay? Patient is having the infections. Infection positive, but symptoms absent. Symptoms. Okay? This is 3 months, whatever. False for filariasis. False statement for filariasis. Yes, no antibodies. Right. Filariasis. Yes. Man is not the intermediate, it is in fact, man is the definitive host. Okay? Here. So man is the definitive host in filariasis. And life cycle of filaria, this is what type of biological transmission? Yes, Pratusha, right? What kind of biological transmission in filaria? See, we have 3 types of transmission. One is propagative, second is cyclopropagative, and third is cyclodevelopmental. Right? And we consider 2 things here. Number 1, increase in number, and second is change in stage. Clear? So whenever we say propagative, there is increase in number, but there is no increase in there is no change in stage. In cyclopropagative, both are present. The parasite will increase in number, moreover it will change its stage. Whereas in cyclodevelopmental, there is no increase in number, only the stage will change, and that holds true for cyclodevelopment. Clear? Cyclodevelopmental is filariasis. Cyclopropagative, remember it for malaria, and this is plague. Here, this. So please remember. Vector for yellow fever. Vector for yellow fever. Very good. Aedes. Aedes, yes. Vector for Zika virus. vector for Zika virus. Yes, this is also Aedes. So yellow fever, Zika virus, remember Aedes, okay, for both. Men is dead end host for. Men is dead end host for which diseases? It means after that there is no further transmission. No further transmission. The cycle will stop there. Yes, this is rabies and tetanus. Okay, very good, Pratyushar, and everyone. So dead end host for rabies and tetanus. Now, a person has a weight of 73 kg and the height of 1.75 meters. Now, what is BMI and what will be the classification as per WHO? So, BMI is weight in kilogram upon height square in meters. Clear? So, you can calculate it something like this, and based on your value you can compare it within the chart. Like if you are saying normal, it has to be 18.5, it has to be between 18.5 to 24.9. So you can just calculate it out. So you can just calculate the value, but just remember only one thing, the height has to be in meters. Don't use centimeter or any other value, right? Next, a 2-year child has been brought to PSC with complaints of fever, cough, and there is chest indrawing. Respiratory rate is 46 breaths per minute in a 2-year child. What is treatment? Chest indrawing with 46 breaths per minute in a 2-year-old child. What is this? See, in 2-year-old child, the maximum acceptable is 40 breaths per minute, number one. And chest indrawing itself suggests that it's a case of severe pneumonia which has to be referred. Right? So it means there is achypnea, okay, what you call fast breathing, because it is crossing 40 mark. Yes, so 40 is the limit. If it goes beyond 40, it is tachypnea or fast breathing. With chest indrawing, that is severe pneumonia. Now, next question. 1.5 years old butterfed has irritability, extreme thirst, and since last 2 days, diarrhea is there, and child is eager to drink. We have already discussed this question in previous episodes. So if he is eager to drink, irritable, this is moderate dehydration. For moderate dehydration, what you need to do? Give ORS solution. So this is moderate dehydration. In demographic cycle, low stationary phase is which phase? Low stationary. It means birth rate is also less and death rate is also less. This is which phase? And please note this word, low stationary. This is not high stationary. This is low stationary, and low stationary will be phase 4. If I say high stationary, then your answer will be phase 1. So this is high stationary, this is low stationary. In high stationary, increased birth rate, increased death rate. In low stationary, low birth rate, low death rate. Clear? So just make sure what actual term is there in the question, high or low. Then only you can say 1 In both the cases, there is stationary, and there is same value for birth rate and death rate. Yeah. Next question. If in a country, if there is low birth rate but higher death rate, what will happen? Suppose it means death rate is more than birth rate. What will happen to population? It will decline. So this is known as declining. Clear? So phase 5, that is declining. Phase 5. As per WHO, what is hemoglobin level to label it as a case of anemia? If it is below, then if it is below 11, right? So if the hemoglobin percentage is less than 11, we will call it anemia of pregnancy as per WHO, right? 11. Minimum number of antenatal visits. Minimum number of antenatal visits 4. Very good. And maximum, I ask you, maximum is yes, around 13. Okay, so 13. Chalo. Prenatal death includes perinatal death includes the perinatal is a little long term, 28 weeks pregnancy, extending till first 7 days of. Clear? So therefore your answer will be option C, 28 days of pregnancy, first 7 days of. So that is perinatal. So if someone asks you regarding maternal and child healthcare indicator, which one is the best in terms of extent of pregnancy wastage as well as the quantity and quality of healthcare available to the mother and newborn, which one is best? Now, this is specifically in relation to the mother and newborn. This is specifically in relation to mother and newborn, not the entire society. And it is also considering the pregnancy wastages. This is perinatal. Okay, please correct. This is perinatal. This is perinatal because 28th week pregnancy, whole pregnancy, and in fetus first 7 days of infancy. So this is, or you can say newborn. Right? So here we are considering pregnancy and this is considering newborn. So prenatal mortality rate is the best for mother and newborn. Please remember. Oh, that's the end of this PYQ session. Finally, we have finished all the subjects, and for some time we will start the image-based sessions, because if you have realized, I haven't kept any image-based question in these subject-wise PYQs because I plan to take it separate session. So see you at 6:30 p.m. today, and we will take that all subject image-based. Thank you, everyone.